All right, good morning, everybody. Welcome to the Ancestry University Working Group Forum for ClinGen. We're excited to have you join us. Just a brief announcement before we get started. We're going to be shifting the Zoom call format to a webinar for October because our September date coincides with Labor Day. So we'll be off for a month, but we'll be back with a slightly different format. So stay tuned for announcements on that via email. Otherwise, I am delighted to be able to introduce today Dr. Karen Parker, who currently serves as the Director of the Sexual and Gender Minority Research Office at the National Institutes of Health, NIH. Dr. Parker was instrumental in the formation of this office in the fall of 2015, was appointed as Director in June 2016. In her role as Director, Dr. Parker is the co-chair of the Trans NIH Sexual and Gender Minority Research Coordinating Committee, a committee she's served on since its inception in 2011. And a co-chair of the NIH SGM Research Working Group of the Council of Councils. Dr. Parker is also a member of the NIH Anti-Harassment Steering Committee and serves as the co-chair of the NIH Office of the Director Equity Council. And she also sits as an ad hoc member of the Advisory Committee to the NIH Director Working Group on Diversity. She's involved in several SGM-related initiatives beyond NIH. Co-chair of the Sexual Orientation, Gender Identity, and Sex Characteristics Subcommittee of the Federal Committee on Statistical Methodology, as well as an executive director of the Department of Health and Human Services LGBTQI+ Coordinating Committee. In 2021, Dr. Parker received the LGBTQ Health Achievement Award from GLMA, a health professionals advancing LGBTQ equity, for her contributions towards advancing the field of SGM health and health equity for SGM communities. We are so excited to have you speak for us today, Dr. Parker. I will go ahead and pass it over to you. If you have questions during the talk, please feel free to put them in the chat or raise your hand on Zoom. I'll be monitoring both as Dr. Parker won't be able to see the chat while presenting. Without further ado, Dr. Parker, please take it away.
Great, thank you so much. And thanks for the invitation to be here. I'm very excited to talk about the work that NIH has been doing related to sexual and gender minority related health. So I'm gonna quickly share my screen, and I will trust that folks can see my slides. So as Clarissa mentioned, my name is Karen Parker, and I serve as Director of the Sexual and Gender Minority Research Office. My pronouns are she and her. So for today, I'm going to give a little bit of background information to do some level setting for folks who maybe don't spend as much time thinking about SGM-related communities as I do. And then I'll talk a little bit about the NIH SGM Research Strategic Plan. For the very first time, I'll be presenting on NIH's grants portfolio and SGM health research for FY 2023. This is newly released data. And then I'm going to talk a little bit about some challenges. In particular, I'm going to talk about the culture of STEM and sexual orientation, gender identity data collection. Then I'll move to talking about some progress and opportunities related to those areas. And then I will finish, if we have time, and I'll talk a little bit about federal SOGI data collection and the NIH SOGI data action plan. So in terms of background, so the constructs that we are most interested in the Sexual and Gender Minority Research Office are sex, gender, and sexual orientation. And so this is just a reminder that sex is a biological construct, that gender is a social construct, and that there are several different sort of pieces to what we consider sexual orientation, attraction, identity, and behavior. And in research, you really want to be sure about what it is that you are interested in studying and that you ask the appropriate questions. So in terms of biological sex, we know that there are sort of several pieces to that. It is not just one thing. It is not just anatomical. And we also know that sex is not binary, which is where sort of many people kind of still see sex and also kind of research. And so we are interested in intersex populations as well in the work that we do. Capturing sex in demographics, for example, is very important, as is gender, depending on the study and what it is that you're interested in understanding. So I mentioned that gender is a social construct, and it really focuses on things like power dynamics and cultural surroundings, and encompasses things like gender roles, expressions, behaviors, attitudes, those kinds of things. Gender also is non-binary, as I'm sure you all understand, and that folks can be can identify as a woman, a man, transgender, a transgender woman, non-binary, right? There are many, many different identities that people hold. And so when we think about this, one of the important things we like to talk to people about is really that gender identity is very personal and not something that somebody can assign to somebody. So, and then we also have sexual orientation. I talked about behavior, attraction, and identity related to sexual orientation, and that this really also is a multidimensional social construct related to gender in many ways, because as people think about attraction, we want to make sure that when we're asking questions in research, that we're very specific and not using binary terms related to both sexual orientation and gender identity. So this is the current definition that NIH uses to identify SGM populations in our research. We updated this in 2019, and when we did that, it was really meant for the language to be more inclusive. We were not sort of adding additional groups or taking out groups of concern, but really thinking about sort of making sure that people could see themselves in the work that we do, and that researchers could see the work that they were doing and what NIH is doing. We have heard feedback from the community about this definition, and we are in the process of attempting to update this definition. Just to sort of update the language related to differences in sex development. And we have been moving more towards talking about variations in sex characteristics. And so you may see an update to this in the coming months. So many of you may remember that in October of 2016, the National Institute for Minority Health and Health Disparity announced sexual and gender minorities as an official health disparity population for research at NIH. This designation, while I think some people felt like it was just sort of, you know, a minor thing that folks were doing on paper, really did, I think, impact the research a lot. It really, I have heard anecdotally from many, many people who do this work, that it really validated their work within their institutions and with their deans and their colleagues. And it really did basically mean at NIH that anytime health disparity populations are talked about, whether it's in funding opportunity announcements, other initiatives, and many different programs, that SGM populations would automatically be included in that work. So for those of you who don't know, SGM populations do face many, many different disparities and inequities, and that is one of the reasons why NIMHD announced SGM populations as a health disparity population. So we just have a few highlights here so that people can really understand kind of the breadth and depth of health disparities. So we know that there are unique challenges in physical and mental health, different social determinants of health, and healthcare access. Just a couple of key points. We know that there are challenges in terms of lesbian and bisexual women who are more likely to report a myriad of chronic disease conditions. Transgender women are at elevated risk for HIV and many other issues related to STIs, violence, mental health issues, and suicide. And they're also less likely to have health insurance. We see rates of depression and anxiety disorders are much higher in SGM populations in general compared to cisgender and heterosexual populations. And then in our office, we are also interested in workforce challenges. And so we know that within STEM, there are lots of challenges related to our SGM colleagues. And so STEM workforce data show inequities sort of across the board, and everything from salary, respect, social inclusion, advancement opportunities. When you compare those to white, able-bodied, heterosexual men. And so real challenges within the STEM workforce. We have data that also demonstrates those challenges at NIH. And we also know that LGBTQ professionals face systemic inequalities across STEM. This has to do with fewer opportunities to develop skills, less access to resources, real challenges in terms of entering the field and leaving the field. And so we are deeply interested in this, and also deeply interested in additional data collection within STEM related to sexual orientation and gender identity. So the Sexual and Gender Minority Research Office, I'll just talk about really quickly. We were established in FY 2015 in September. And we sit in the office of the director at NIH. We do not have grant making authority, and so we don't hold a portfolio, but we are specifically situated within the office of the director so that we could really have a bird's eye view of the agency and help to coordinate SGM related work across NIH. We also represent NIH at things related to SGM health research, whether it's conferences or workshops or things with our colleagues within federal government. We serve as a resource for the extramural research community and for the intramural NIH folks. So we provide a lot of technical assistance here at NIH on things related to SGM, whether it's language in funding opportunity announcements or reviewing resources, working with the Office of IRB operations to make sure that the standard protocols at NIH are inclusive and affirming, right? So sort of across the board. And then in terms of the extramural research community, we spend a lot of time connecting folks to program officers at NIH. So we understand that NIH for many people can be a big black box and a very scary place. And so I'm often saying to principal investigators, particularly students and early stage folks, that if you don't know where to start with us and we'll help connect you to the right program officer who holds a portfolio in the area of research that folks are interested in. We convene experts and hold scientific workshops within the Sexual and Gender Minority Research Office. And we really do that to sort of look across the board at where are there key research opportunities in SGM-related health research. Of course, we always collaborate with our ICO colleagues. We are a very small office with a small amount of resources, and so we're oftentimes looking to leverage resources with our colleagues. And then we lead initiatives like communications efforts and reporting efforts related to SGM health on behalf of NIH. So how do we accomplish these goals? So we have a small staff within the OD, but then we also have a research coordinating committee, and that has representation from across the different institute centers and offices at NIH, and we come together on a regular basis every month to really talk about new initiatives and barriers at NIH to conducting this work, and then working together through the ICOs to help advance the work. We also have a working group of the NIH Council of Councils. So the Council of Councils is our division's advisory council. So as you probably know, all of the institutes and centers have advisory councils, and those councils are a part of peer review in terms of our grants. And so we also have a council in our division called the Council of Councils, and we have a working group of that council that is made up of extramural experts, and those folks come together on an annual basis to really help us think about where are we headed, and they help us on things like our strategic planning and our mid-course reviews to the strategic plan, and they make recommendations on things that we can do to move our goals and objectives forward. We also do a lot of cross-agency collaboration. A couple of these things were mentioned when Clarissa introduced me. So we have an HHS LGBTQI+ coordinating committee on which I serve as an executive director. And then I co-chair the research and data subcommittee of that group. That's very sort of internally focused at HHS in terms of how we can move this work forward. We have a group that sits within the Federal Committee on Statistical Methodology that I co-chair that's focused on data collection of sexual orientation, gender identity, and sex characteristics. And just another example of some cross-agency work is the SOGI Data Interagency Working Group that developed an evidence agenda on LGBTQI+ equality. So NIH does have a strategic plan just specific to SGM related work. This plan is not a sexual and gender minority research plan. This is an NIH plan. And so the expectation is that all the institute centers and offices will be thinking about this plan. But these are the four operational goal areas. This is our second strategic plan, and we are currently in the process of planning for our third strategic plan that will be released in September of fiscal year 25. So in just a little over a year. But our current goal areas are to advance rigorous research on the health of SGM populations in both the extramural research community and intramurally at NIH. To expand SGM health research by fostering partnerships and collaborations. And so we think about that both internally at NIH and within government and externally. Operational goal 3 is really focused on those STEM issues I was talking about. So fostering a highly skilled and diverse workforce in SGM health research. And we really are interested in making sure that we have a robust research community of folks who are doing this work, regardless of how they identify. And we are also deeply interested in people who identify as a sexual or gender minority, but who are doing any kind of work in STEM. And so if you can imagine a Venn diagram of those two communities, there is certainly some overlap, but also very distinct spaces. And then operational goal 4 is to encourage data collection, both in research and in the health research workforce related to sexual orientation and gender identity. So now this is the new part of my presentation that I've never presented before because these data are new. And so I'll be talking specifically about FY 2023, but comparing it sort of to our previous data collections related to the portfolio that date back to FY 2015. So in FY 2023, NIH funded 672 unique SGM related projects. So this slide I know is very busy, especially for folks who don't live and breathe NIH. But basically this just tells you that the National Institute on Mental Health, followed by the National Institute for Allergy and Infectious Diseases and the National Institute on Drug Abuse fund the most number of projects within the SGM space. This slide shows the previous 5 years. And so what you can see here with this trend data is this sort of consistent uptick in the number of projects that are being funded. And you can also see that there are several institutes and centers that have sort of within the past several years kind of gotten into this game. Several of these maybe don't have as many obvious connections or intersections with SGM related health, but folks around NIH, I think, are really working hard to understand where are some of the opportunities within SGM related work. And so you can see this sort of steady growth over the years.
Karen, how are those defined?
So those are all done via our RCDC coding and our NIH spending categories within NIH Reporter. And so we work closely with the people who do the back end sort of data algorithm work. And so we come up with key terms. We work with experts across NIH. There's a lot of weighting. And so what we typically do when we first started doing portfolio analyses, we would just look at NIH Reporter, and then we would report on those in ways that we could do within NIH Reporter. In the past couple of years, we have had more capacity in our office. And so now we have like a part 1 of our portfolio analysis that is basically analyses that anybody could do if they really dug into NIH Reporter. And then we have folks who actually curate our data and who read every single abstract and specific aims and do coding. So now we have a part 2 of our portfolio that gets a little more into the nitty gritty. But we do pull these sort of original projects from Reporter, and then we check them. So basically like next summer, after when we're working on finalizing the 23 portfolio analysis, the final N might change a little bit because sometimes we do reviews and we say, you know what, these 3 projects really aren't SGM related, but there was some language in the abstract or the specific aims that made the algorithm pick it up, right? So that's how it's all done by algorithm. And then we do manual curation of our specific portfolio. And then that's why some of the numbers can change. And so the 672 is just the original, like sort of our first pass at pulling the data through NIH Reporter. I have found though that over the years that algorithm, you know, we continue to work to refine it and make it better. It's difficult to know. It's easy to catch the false positives because we're reviewing all of the applications. It is more difficult to catch the false negatives because we're not reading every application that's being funded at NIH for these work. So this slide I'm actually really super excited about because when the office was established in FY 2015 and we did our first portfolio analysis, 73% of the portfolio was in some way related to HIV or AIDS. And so as you can imagine, there were reasons for that. There were historical reasons for that. And so one of the goals of our office, while we wanted to see that HIV portfolio continue to grow, which it has, we wanted to see a more balanced portfolio, right? Because we know that there are so many other questions in SGM related health beyond HIV and AIDS. And so FY23 is the first time that the non-HIV AIDS projects are more than the HIV AIDS related projects in SGM health. And so for me, this is a really significant slide, and I think really is just a testament to the research community and folks at NIH really understanding that we need to move beyond HIV and start really looking at a broad array of issues within health. And so I'm very excited about this slide. And then this does highlight sort of the different disease areas and health conditions. This is not the whole portfolio. These are just some key areas where we did some crosstabs with other RCDC categories at NIH. And so we picked these to show some of the kind of biggest areas that work is happening. The fourth one in is dissemination and implementation research. And then we picked some other ones to really demonstrate where there is a lot of need, right? So we really understand that we need more research looking at things like suicide, tobacco, opioids, right? Kind of across the board. And so we are seeing some changes in the portfolio. Certainly there's spaces like cancer where that portfolio is really growing. I will say though, a lot of times people will either look at a slide like this or they'll look at the slide by institute, center, and office funding, and they'll say, well, NHLBI must not be interested in this because there's very little work happening in heart disease. And what I'll say is that we can't fund what we don't get. And so there are several institutes, centers, and offices that just do not receive the same number of applications. It does not mean that they aren't deeply interested in this work. And so I would say any area of work that you're interested in, NIH, if it's, you know, sort of within the scope of NIH and health related, we are interested in funding that work. So this just looks at the different types of grants that NIH funds, and so looking at the different mechanisms. And so this sort of gives you a sense that, you know, nearly 60% of what we're funding are R's. So the R01s, the R21s, the R03s, those types of grants. We are seeing some spaces that are growing, some of the research career programs, for example, and the fellowships, which we're really interested in the career training areas, and a lot of the work that we see within variations in sex characteristics. A portion of that is happening intramurally at NIH, but we do also know that the intramural program is an opportunity for additional SGM related work to happen there. So just some key takeaways for the FY 2023 portfolio analysis is that we have seen this really large jump in the number of projects since 2015, 123% increase. I mentioned how excited I am about this more balanced portfolio related to the non-HIV AIDS funded work here at NIH. In terms of R01s, we've seen a large increase in the number of R01s funded in SGM-related health research since 2015. And in 2023, we saw 24 NIH ICOs funded SGM-related health research, and that's up, I think, from 21 in FY 2022. So now I'm going to move on, do a time check. Now I'm going to move on to talk about some of the challenges that we face. So I've mentioned both the culture of STEM and SOGI data collection. So I'll just talk a little bit by talking about some interesting findings at NIH. So in 2020, NIH did a workplace climate and harassment survey and found real challenges with the SGM community at NIH in terms of people experiencing sexual harassment. And we really knew at NIH that some things needed to happen, right? We have since done another workplace climate and harassment survey, and we find that many of those problems remain. And so once I have that data, I'll be updating these slides, but we know that there are still challenges just at NIH in terms of the climate and harassment survey. And then when you look generally at the research that folks have been doing about LGBT plus populations, we know that in terms of federal agencies, folks report more negative workplace experiences, and they're more likely to experience career barriers, harassment, and devaluation compared to non-LGBT people in the federal workforce. I mentioned some of these systematic advantages for white, able-bodied, heterosexual, and cis men. I believe they looked at gender identity there, and the things that they sort of experience related to LGBT populations. We know that SGM students in STEM report a lower sense of belonging. And as you can imagine, the current socio-political climate surrounding LGBTQI plus issues might have an impact on folks' ability or willingness to conduct SGM health research. And so we're deeply interested in this at NIH because we know that we really need to expand the evidence base sort of across the board. And so there are some current legal challenges that we know researchers are facing. And then when you look at sort of what's happening related to SOGI data collection, SOGI data are not systematically collected in the national data sets of STEM trainees and professionals by the National Science Foundation. They are currently testing some measures, but they're not doing this across the board in all of their surveys. We do not at NIH collect sexual orientation or gender identity data of our grant applicants and principal investigators, which is something that our office has been fighting for. We also have planned enrollment and inclusion tables that are very limited. And so we know that we are asking researchers to put people into boxes that they do not belong in. And that does not feel good for a lot of people. And so we are, attempting to work on that issue. We also know that people are very confused by NIH's notice of interest in diversity because LGBTQI plus individuals are not explicitly identified in that notice, and yet they are included. And so that is something that has been a real communications challenge, not just with us in the extramural community, but also internally at NIH. There have been a lot of NIH people who are confused and who are, in my opinion, giving some not great advice to principal investigators. So what progress have we made? This is not all the progress we've made, but these are sort of some key things that have happened. So in terms of the culture of STEM, both at NIH and in research, NIH has been working really hard to hear from the community. And so we've done several DEI related listening sessions that have included NIH leadership. There was an establishment of an SGM working group of the NIH Anti-Harassment Steering Committee. So I'm a member of the Anti-Harassment Steering Committee that was established as a result of the NIH climate survey that I spoke about. And just this past winter, we established an SGM working group that I'm co-chairing with the chair of the NIH SGM Employee Resource Group. So we've gathered folks from across NIH, and we're really sort of reviewing many different areas of NIH and making recommendations to the Anti-Harassment Steering Committee about very specific actions that NIH can take to improve the culture for SGM populations. We have been developing in our office several resources to enhance workplace inclusion. So we have developed, we're not calling it a training because people don't like that word, we're calling it a resource, but it's called the Culturally Competent Gender-Related Communications Resource, and that's a video that sits on our website that's basically a training about how to have more inclusive language. It really was developed kind of for NIH, but is really appropriate for anybody. And so we see people kind of across extramural, across the public who are using that resources to learn about SGM communities. That communications resource also kind of goes beyond SGM populations and also talks generally about other challenges in research. So for example, reminding folks that in peer review, research has shown that women are more likely to be referred to as their by their first name, and that men are more likely to be referred to as Dr. So-and-so, and some of those real challenges about making sure that things are sort of level set in those kinds of communications. We also have a part of our web and also a downloadable PDF that talks about gender pronouns in the workplace. And we recently in our office, and by recently, I mean the end of July, hired a new staff member who is dedicated specifically to SGM specific workforce issues. And so that will be, you know, that's everything from looking at the culture of STEM to running our Research Investigator Awards program, to also working on our regional workshops where we do grants personship workshops in collaboration with different institutions to really help lift the veil off of NIH and make sure that people feel comfortable in terms of their interactions with the agency. And then we do lots of collaboration with interagency and federal-wide DEIA activities. We were deeply involved in the NIH DEIA strategic plan. And so we really want to make sure that as people are thinking about DEIA, that they're not thinking about those issues in a narrow way and that SGM populations are included. And then in terms of SOGI data collection, so our office sort of led the effort at NIH to fund the National Academies of Sciences, Engineering, and Medicine report on measuring sex, gender identity, and sexual orientation. We also hired a staff member in 2021 who is dedicated to that work and who is working on providing a lot of technical assistance across the board. In fact, that staff member was asked to go on detail to HHS to help HHS develop the HHS SOGI data action plan, and has been really leading NIH's effort on our SOGI data work plan, really looking across the board to identify where is NIH collecting demographic data, are they collecting SOGI data? If not, can we, how can we, and what is the best way to do that? And then we also have a working group on gender that is a working group of the Inclusion Governance Committee, where we're really looking at the sex as a biological variable policy, the sexual orientation, gender identity, CDEs, because that's something that we would like to see in the future, and also updates to the inclusion tables. So now I was going to talk a little bit about federal SOGI data collection. Clarissa, do you think I should stop and just have a discussion now, or do folks want to hear more about federal government activities related to SOGI data?
I think we have time to hear about it.
Okay, great. Okay, so I'll just sort of quickly talk about what's been happening in this space. So the National Academies, as you know, government uses them oftentimes to really sort of help make recommendations and set the stage for what needs to happen. So NIH funded in 2009 sort of the seminal report on the health of lesbian, gay, bisexual, and transgender people that was really the catalyst for the NIH Research Coordinating Committee and the establishment of the Sexual and Gender Minority Research Office. We then in 2020 co-funded this consensus study report that sort of looked beyond health, but that looked broader at LGBTQI plus populations, but certainly included a whole section about health. And then we did another consensus study on measuring sex, gender identity, and sexual orientation. So these across the board, all of these reports have talked about the need for additional and consistent SOGI data collection by the federal government. So guiding principles of the most recent report are inclusiveness, precision, autonomy, parsimony, and privacy. And so these sort of guiding principles or values are what has really sort of led us to focus on pushing forward these data and how to do so in an appropriate way. So work on this has been happening for a very long time. I mentioned the Federal Committee on Statistical Methodology, the FCSM. So, you know, this work has started a while ago when an interagency working group on measuring relationships was talking about how do you capture people in same-sex relationships, for example. And then as we sort of move forward, we've had interagency working groups looking at measurement. And then we had in January of 2023, I mentioned this federal evidence agenda on LGBTQI plus equity. that was a result of an executive order from the current administration. And then there was an OMB report that was released in January of 2023 as well that talks about recommendations on best practices for the collection of SOGI data on federal surveys. So we've been really talking about this for a long time, and the National Academy's studies have really driven this work across efforts. So Executive Order 14075 was released by the current administration, and this was really a broad executive order that talked about many, many different things, including additional research in specific spaces. But one of the main things that it talked about was inclusive and responsible federal data collection. And so that included, I mentioned this OMB report that came out. So it called for an OMB report. It called for a federal evidence agenda, which was developed across departments and agencies. And then it also required development and implementation of agency SOGI data action plans. And so the federal evidence agenda is really this amazing report that lays out sort of where the needs are. It lays out a learning agenda, basically what questions could we answer in the federal government if we collected SOGI data. And so it's a really amazing resource for administrative data collection. And there's also a lot of information in there that talks about, you know, what folks need to be thinking about as they're thinking about collecting this data. And really, it's sort of the first ever report of its kind related to SOGI data. So it talks, I mentioned it talks about data needs. So where are those gaps? It talks about the learning agenda topics, and this goes well beyond health, right? So it does have a section on health, healthcare, and access to care, but it also talks about housing, economics, education, and then safety, security, and justice. And then there was a whole subcommittee that worked on administrative forms. So really making sure that people were collecting data, especially administrative data, in a responsible way and in a way that would prevent or protect people's privacy. So then the SOGI data action plans were being developed at the departmental level. HHS developed one. This is the requirement within the executive order that talks about each agency will develop a plan. And so HHS did that, and HHS's plan was really developed by some specific colleagues in the Office of the Assistant Secretary for Health, NIH, and the Assistant Secretary for Planning and Evaluation. But it took a huge sort of like bird's eye view of the department and then made some requirements. And one of those requirements was that each HHS component, so places like NIH, CDC, HRSA, that each component would develop their own work plan related to SOGI data. So this is kind of where we are with the HHS action plan. The SOGI data plans were due to HHS in June, and so NIH submitted ours. And so we're really looking at an evidence building infrastructure. So how can we make sure that we're collecting data across HHS? How can we make sure that the data is done appropriately? And then how can we continue to update the progress that the folks across the agencies are making? So that's kind of where we are. I'm excited about where the SOGI data collection is moving, especially at NIH, because we're working with our colleagues across the board. This is just if folks have questions or want to connect with me, feel free to reach out. We have a lot of resources on our website, including a section called Research Resources, which is we pull together a lot of information from across NIH, but also some information that is very specific to SGM related work. And then I would encourage folks to sign up for both our listserv and for our SGM Health Scientific Interest Group.
Thank you so much, Dr. Oh, sorry.
Yep, no, I think that's it. So I'm happy to take questions or comments.
Yeah, and again, thank you so much for joining us. This is definitely a topic that's been kind of floating around for Clinton as we're rethinking how we collect our own, for instance, demographic data and make updates there. How we've been working with our data access protection and confidentiality group, thinking about how we do curation of data. And, one piece of that is how do we curate, gender data, what's important, how are we using it, things like that. So if people have questions or thoughts, please feel free to raise your hand in the chat or add them to the Zoom chat. I know Sharon
Yeah.
had some
So
mentions.
Karen, thanks so much. I would say, I'll just admit right now, as an NIH funded investigator for many years, I really had no idea that hardly any of this was going on. And I am concerned, and I sort of put in the chat that unless this gets to the point of on the biosketch, there's a section where you fill this out, or when you go to, NIH Assist, there's a section where you have to report on this, that people are going to sort of remain in the dark that NIH is concerned about it. I mean, we've dealt with this, and I just, the OMB guidelines just came out, and they're still just straight race ethnicity questions. And people are already dealing with, okay, how do we deal with the fact that they've added a couple of categories? So in ClinGen, we've dealt with this because, we have a diversity of our workforce goal. Mm-hmm. There's nowhere in our grant application that we report on that. And in fact, we got dinged by reviewers, and I'm like, how do they even know? Like, they have no idea what the diversity of our workforce is. And so we've now tried to do a questionnaire, and the questionnaire does include some of these topics. And I don't know how so we did it anonymously at first. And now in our GPM, which is our management system for members of all of our committees, there are now a series of questions. To be honest, I did it a month or two ago. I'm not sure how close it maps to the most recent set of recommendations from the National Academy. But I'm just wondering, are you making any headway with this information becoming part of a standard grant application? And Terry Klein, I'm not sure she realized she only replied to me, but mentioned the same thing's true of disabilities. A lot of the disability question, at least, is part of training grants. Although this, again, sexual minorities is not part of training grant diversity status. So I'm just sort of wondering what progress you're making in terms of getting these things into the things that NIH grantees are used to having to provide.
Yeah. So, well, okay. There's a lot to unpack there. So, you're right. We're not collecting this information. We've had lots of conversations with the Office of Extramural Research about the need to update e-commons, right, where we're collecting other demographic data, that we need to be collecting this data so that we can then do some barrier analysis to see, are there challenges happening in terms of funding, for example. OMB, you're right. OMB does not have, there is no OMB directive related to SOGI data. What we've been having, so the challenge that we've been having, and I don't think, we've had lots of conversations with OMB, and I don't think that what we want is an OMB directive. And that is because when OMB does a directive, the language gets set in stone for decades, right? So we know how long this takes to update. And the challenge is that we know that language evolves, right? So even what came out of the most recent National Academies report is kind of not really even where we're headed, right? Because we're recommending, if people ask, not an official recommendation, but when we talk to people, we do talk about, for example, the need to have a non-binary option when you're talking about gender identity, right? So we know that things will evolve. OMB was required to do a best practices report. They did a best practices report that did include information about the need for additional research. And they gave some example questions that basically said, these are not required questions. We want people to ask these questions. We want people to research these questions. These are examples. And what happened is that now desk officers and OMB are interpreting that report as this is the way you have to ask the questions. And that's causing problems. And so when people submit packages, at least in federal government, they submit packages to OMB with questions they want to ask. And when they continue to get feedback no, and they're getting their packages rejected, for reasons that are very unclear to a lot of people, then people start to give up and say, I'm just not going to ask the questions. Right. And so that's what we really want to avoid. So it's been, as you can imagine, federal government's huge. So we have been working not just at NIH on these issues, but really across HHS and then beyond, but working with OMB and making sure those communications are clear has been challenging. Having said that, I still don't think an OMB directive is necessarily where we want to go because the language really can evolve and because we still have so much research to do related to this measurement. And so, but yeah, we are making headway, right? So we have been making, we meaning like committees at NIH have been making recommendations about a lot of those things for a while. The real challenge is that, for example, if NIH wants to update certain forms, the process that we have to go through as a federal agency can take so long that for a lot of it's like planning to do something now that might happen in 2027 because 50 other agencies have to like review and it has to go through public, there's just a lot of those kinds of things. We do have many, many more people at NIH and beyond that are connecting with us about technical assistance related to SOGI data and who are adding questions, for example, into some of the really large health surveys. Medicaid at CMS just added some of these questions to their the marketplace enrollment. So definitely there are big shifts happening currently, but it's we really are pushing a big boulder up a very steep hill, but we're definitely getting up the hill slowly but surely. So yeah, I don't think I really answered your question, but we are making progress. It's just slow, and I'm not surprised.
Well, I understand that, but as a grantee, I'll push back a little bit. As someone who has spent their career writing NIH grants, if NIH doesn't ask us the question, then people get really pissed when they're ding. And I'm not talking about our recent experience, but I'm just saying in this topic, it doesn't appear anywhere in the stuff we read that says, what do you need to do? Like Aaron Ramos is on the call. So if we look at the community resource U24 that we're going to be submitting again in a year, is any information about this topic included? I'm not sure it is. And then, people get upset like, well, how are we supposed to tell you what we're doing in this if it's not even, so let's skip OMB and let's skip, trying to change the biosketch. But, we read those documents, we read the RFAs and the program announcements very carefully. Is there a way to at least get the language about this into those? I assume it is in the HIV RFAs. And is that some language that could be adopted for some of these other documents?
Yeah, so there's standard templates, and then there's like people who are developing initiatives via program announcements and other FOAs, right? So it's probably like a two-pronged approach, right? But we have tried on several. I'll just say this, at NIH, when people talk about diversity, they don't always mean SGM. And
no,
so
they don't. No,
we're sort of on a pretty regular basis working with people to make sure that they understand why SGM populations need to be included and why they need to be explicitly called out. Because we say all the time, you cannot assume that people will assume that they're included. You have to make sure that they explicitly know that the work is included. So yeah, you point out a very big challenge.
Anna also.
Anna has her hand up.
Oh, thank you. Thanks for spearheading all of this great work. Yeah, two questions. One, so I'm a little bit confused. If I'm designing a survey or something, where should I look to for getting the best, most updated questions? So it's not the NASAM report, I take it. So I'm sorry if I missed this. What do I need to refer to? And the second question is, I'm I'd be interested in what guidance or what resources there are for kind of then how to use those variables in analysis and like for the downstream stuff. So like, okay, you've asked it in your survey question, but how is one supposed to, I don't know, like which ones can you group and not group together for which types of analysis, and how do you describe these various groupings, etc. Where can you point me to anything?
Yeah, so we do have a website focused on methods and measurement. That's a part, like a web page that's a part of our website that pulls together a lot of resources and how people are doing that. We have a staff person who has focused on these issues exclusively, and her name's Christina Dragon. She's always happy to connect with people and talk about these things. The current sort of way that we're talking about the measures really is just sort of adding a non-binary option, I think, to the gender identity question. So we're not really veering away in a major way from what the Academies has recommended. And I don't think, I think if you have a reference to the Academies and you want to ask those specific questions, I think that's appropriate for a research study. Many people are doing that. And then we, like I said, you can talk to Christina. We are hoping to have some information that's more publicly available to folks about sort of how NIH is interested in folks asking the questions. Some of it also depends on your study. So if you're looking, if you're working with SGM populations specifically, then you might want to have much more expanded questions. And then in terms of the analysis and sort of how do you think about grouping the population, I'm assuming that you're talking about for, the ability to have enough folks to actually find something, to study something meaningful. Certainly, there are experts out there who are constantly working on SGM related data who you could find advice from, and there's research in this area that we could point you to. So you can feel free to reach out to us. In general, people are really recommending that you look at specific data as much as possible and not just say the SGM community, for example, or lump LGBTQI plus people together when that's very less meaningful than if you can look across the different constructs. But a lot of that really just depends on the size of your study and what it is that you can accomplish. In some areas, there's such little research that even saying something broad about the community is better than saying nothing.
Stephanie?
So can I just say really quickly, I can't find Christina's email online. If it would be possible to stick in the chat, that'd be great. Thanks.
Yep.
So since this is a ClinGen forum, I'm curious if there's any recommendations specifically related to genetics research that is sort of coming out of this effort, because historically in genetics research, there's like one of the standard quality control measures that researchers will do is to say, does your, sex as reported on whatever, demographic information we have match genetic sex as often as very crudely interpreted as the amount of heterozygosity you have on the X chromosome, and anyone who is not falling into the expected range for males and females of heterozygosity on the X chromosome just gets dropped from analyses. So people who are intersex or have, different, numbers of chromosomes, or just have, some variation that is not putting them in the two main clusters of what we expect, get specifically excluded from genetics research. And is that being discussed at all in this effort?
Yeah, I mean, that's definitely one of the challenges, is thinking about the way that people are included and excluded from research studies. Oh, thank you, Erin. So as Erin points out, we really don't have a great answer to this, but NHGRI just a couple of weeks ago, along with SGMRO and the Office of Research on Women's Health, did have a symposium, a 2-day symposium, where we looked at exploring the many dimensions of sex and gender in genomics research. I don't know, Erin, do you know if that's been posted yet to the website? That it will become public on the NHGRI website, and people can go back and look at the studies. But these kind of challenges were discussed, and this is just, I think, a really good example of why people really need to think deeply about what it is that they're looking at and what it is that they're studying, and then trying to figure out the best way to measure it, and the best way to be as inclusive as possible. Erin, do you know if that's been posted yet?
Yeah, so all the videos from that symposium, which was phenomenal, are posted. I don't think the workshop report is posted yet, but all the videos are there. And then at the bottom of the page, there's a lot of really relevant links per this discussion. So if you click on that link that I put in the chat and scroll to the bottom, you can see some of the references and resources.
I'll be sending that out as well. I was already waiting for those to come out just to send to attendees of a previous workshop that we had as well. So I can send them to the Ancestry Diversity Working Group.
Yeah, and I would say, I think that, NHGRI, as Erin can attest, NHGRI is very interested in this work. But I think is moving forward with a lot of these things in a very sort of mindful way to make sure that the work related to sexual and gender minorities and genetics doesn't get misinterpreted or misused in order to hurt the community as opposed to help the community. So NHGRI is definitely, though, I think, making some really great strides, and the workshop was really fascinating. And if you're interested in learning more, I would really recommend going back and looking at some of the videos.
I think we have time for any final questions before we wrap up. Otherwise, thank you so much, Dr. Parker. We really appreciate you coming to talk. This was fascinating. I will be sending the recording out shortly alongside links to the symposium resources from that talk. And then just again, for those who weren't here at the beginning of the forum today, we are going to be shifting the Zoom formats for our next call. We will not be having a September forum due to Labor Day, but I will send some emails out regarding that shift to a webinar format just to make it a little bit easier to pass it along to folks who may be interested. But thank you all. I hope you have a phenomenal week. And that is it for today. So,
thank you.